Okay, everyone, it's time to start tube feeds for your patient. What enteral access do you choose and why? Let's dive in. Choosing the optimal enteral access depends on three key factors. One, how long do you think your patient will need enteral access? Two, where does the enteral access need to terminate in the GI tract? And number three, is the enteral access needed for nutrition, medications, decompression, or all of the above? Let's dive into factor number one. How long do you need enteral access? If it's less than 4 weeks, a temporary option like a Dobhoff tube, NG tube, aka a Salem sump, or endoscopically placed nasojejunal, or NJ tube, would be best. For enteral access longer than 4 weeks, more durable access options such as a PEG tube or percutaneous gastric tube, a G tube, a J tube, and the special GJ tube are appropriate. Honestly, you might not know for sure how long your patient may need enteral access, and so you often might even place a temporary option until you know further. Now on to factor number two. Where do you need enteral access to terminate in the GI tract? Our gastric enteral options end in the stomach and include Dobhoff tubes, NG tubes, PEG tubes, NG tubes. PEG tubes are placed endoscopically through the esophagus and attached through the stomach from the inside. G tubes are inserted surgically or with interventional radiology into the stomach from the skin on the outside. Our jejunal enteral access options end in the small intestine and include the nasojejunal tubes or NJ tubes and the J tubes. And lastly, GJ tubes are special. They terminate in both the stomach and the small intestine. They do this with their 3 ports, the gastric port, the jejunal port, and a port for the balloon to hold it in place. How do you choose where the tube terminates? Often, gastric options are acceptable. Jejunal options are great for patients with gastric obstructions. For example, you can use a GJ for a patient with severe gastroparesis, where we wouldn't want to feed through the gastric part since the stomach motility is compromised. Instead, you can feed through the J, aka the jejunum. And last but not least, the third factor to consider. What do we need enteral access for? Do we need it for nutrition, medications, decompression, or all of the above? Let's take a look at our short-term access options first. Remember, our short-term options are the Dobhoff tube, the NG tube, or the NJ tube. Great news, all temporary access options are compatible with tube feeds. For your patients with a lot of medications, especially when they cannot be given IV and need to be in pill form, Dobhoff tubes and NG tubes are the best for medications because meds can get stuck in the thin NJ tube. Note that one thing to keep in mind with the Dobhoff is that enteric-coated meds, extended release formulations, levothyroxine, or levodopa cannot be easily crushed or given via Dobhoff. Talk to your hospital pharmacist to ensure meds are compatible. So we've talked about tube feeds, we talked about meds. What about decompression? NG tubes, which are larger and more rigid, are the best option for decompression. Dobhoff tubes and NJ tubes cannot be used for decompression. So in summary, if you need a temporary tube for decompression, choose the NG. If you need it for meds and or nutrition, elect for a Dobhoff. How about our durable enteral access options? Again, this is for patients who need enteral access for longer than 4 weeks. What are our long-term access options? The 4 options are the PEG tube, the G tube, the J tube, and the special GJ tube. All durable access options are compatible with nutrition and medications, and all of them can be used for decompression as well. A special note for the GJ tube, it allows for decompression from the stomach via the G port while feeding through the J port. Think back to our patient with the severe gastroparesis. We can decompress the stomach with the G tube, giving it a rest while feeding through the J tube. Okay, let's summarize. Factor number 1, duration of use. Short-term access options for approximately 4 weeks or less include the Dobhoff tube, the NG tube, also known as the Salem sump, or the NJ tube. Long-term access options include the PEG tube, the G tube, the J tube, and the special GJ tube. Factor number 2, location, location, location. Determine if access should terminate in the stomach, such as with the Dobhoff, the NG, the PEG, and the G tube, or in the jejunum, such as with the NJ, the J tube, and the GJ tube, depending on if they have gastroparesis or gastric outlet obstructions. Lastly, factor number 3, what we are using our access for matters. All modalities are compatible with nutrition. And of our short-term options, the NG is the best for decompression, and NJ tubes cannot be used for medications. Luckily, all durable access options can be used for nutrition, medications, and decompression. For more learning on tube feeds and enteral access, check out our Tube Feeds 5 Pearls podcast wherever you like to listen. And check out our website for show notes and infographics. Thanks.